Hi, this is NurseEdScholar, and today I decided to start making some videos that go over NCLEX-style questions. I've been given a lot of information for you to study, but I think it's time to start adding some questions in to kind of give you some tips for um, figuring out what's the right answer and how to look at questions. And so I hope that with these next several videos, just breaking down questions or NCLEX style questions with their rationales, kind of talking through them, giving you some tips and, kind of developing those critical thinking skills. It will help you with your examinations and with the NCLEX itself. So let's get started. So with our first question, it's a nurse is caring for a patient with advanced COPD, receiving oxygen at 2 liters per minute per nasal cannula or via nasal cannula. The patient's oxygen saturation drops to 85%. Which action is most appropriate? A, increase oxygen to 6 liters per minute and reassess in 15 minutes. B, keep oxygen at 2 liters per minute and monitor closely. C, place the patient supine to improve oxygenation. And D, call the provider for intubation orders. So I'm going to give you about 3 seconds. Just kind of look through that stem and those responses. Okay. All righty. B, keep oxygen at 2 liters per minute and monitor closely. Alrighty, so why are we doing this? So why is B the answer? So when you're looking at COPD patients, especially those in advanced disease, they rely on low oxygen levels. Okay, so low oxygen levels will trigger breathing. So we talked about hypoxic drive. So go back to that hypoxic drive video. So high oxygen will shut this drive down. So the patient will start to hypoventilate. And so with hypoventilation, you'll have increased retention of CO2, which will cause the accumulation of carbonic acid, because when carbon dioxide mixes with water, it's carbonic acid. So now the patient will be in respiratory acidosis, will lead to respiratory failure. So you want to make sure that you keep those oxygen levels low. And monitor closely. So if you look at the stem doesn't talk about the patient was restless. It doesn't talk about the patient had any kind of mental status change. It didn't say anything about the patient being distressed. It did say that the oxygen saturation dropped, but you always want to look at your patient. What does your patient look like? Okay. So with this, if you would have picked A, increase the oxygen, or C, lie supine, that would make the patient worse. Remember, increased oxygen will cause the patient to hypoventilate because of too much oxygen. And C, in the supine position, they won't have that the lungs won't be able to expand. So it's not going to improve oxygenation. And then D, at this point, calling the provider for intubation orders is a little premature because it doesn't say in any way, shape, or form that the patient was in any kind of distress. So look at the intervention that you can do now that will stabilize your patient without any harm. And the answer B is your best choice. All right, let's try another one. All righty. A patient with community-acquired pneumonia is admitted with fever, productive cough, and dyspnea. What is the primary action? A, give antipyretics for fever. B, encourage oral fluids. C, administer IV antibiotics as prescribed. Or D, obtain a sputum culture before starting antibiotics. I'll give you 3 seconds. Okay. D, obtain a sputum culture before starting antibiotics. So why? Okay. All of the answers are right, but this is a priority question. What is first? And given all of these responses, you want to obtain that sputum culture first. Why? Because you want to know the pathogen that is causing this pneumonia. Okay? If you give the antibiotics first, it's going to skew the sputum results. Fever control and hydration, those are supportive methods, and you are going to perform those interventions. However, the most important thing right now is to get that sputum culture. Alrighty. So when you're looking at first action questions, look for assessment or some kind of diagnostic before the intervention. Okay. And in this question, the culture is kind of like the foundation. Everything builds on it. You need to know what the pathogen is first, what you'll receive from the culture results, and then that'll determine the antibiotic and things like that. So for this question, sputum culture, main priority. Alrighty. So let's move on to question 3. Alrighty. A patient in acute COPD exacerbation is struggling to breathe. What position is best? A, supine with legs elevated. B, semi-fallers. C, high fallers leaning forward on an overbed table, tripod position. Or D, sideline with pillows. Give you 3 seconds. All right, let's see if you got it right. High fallers, leaning forward and on an overbed table, tripod position. So before I talk about the rationale, I just want to say something. When you are looking at your responses on your test or even NCLEX, they try not to have one like this one. The right answer is very long compared to the other ones. Typically, the responses are going to always be close to the same length, just so one doesn't stick out. In this one, the answer does stick out, but I just wanted all of that information on there so you could see that this is the position that the patient needs to be in. So let's go to the rationale. So the tripod position, that promotes maximum lung expansion by allowing the diaphragm to move more freely and the use of those accessory muscles. So that patient will be leaning over the table, leaning over and sitting up high. Remember, supine is not good because your lungs aren't going to be able to expand because the pressure of the patient's body is going to be on the bed. So they're not going to get that good lung expansion. Semi-fallers, that's okay, but that's not the best position. The high fallers is the best position for the patient. Okay. Think about it. When a COPD patient is in distress, they're going to sit up and lean forward. Okay. Sideline with pillows, that's not going to maximize your ventilation. Even if you sideline, it's just an awkward position for the patient. So it's not going to be the best to maximize ventilation. So if they ever talk about respiratory distress, if they ever talk about what position is best, it's always high fallers, unless it is contraindicated or it's always upright. Let's just say that. So it's always upright. Unless, like I said, it's contraindicated. And that would be told in the stem of the question. So think of it like this. Let's do the critical thinking piece. Look at a runner. When a runner finishes a race, they typically lean forward. Not, they're leaning forward on, they have their hands on their thighs. But just think of leaning forward and then having the patient sit upright. Okay? All right. So let's move on to the last one. The last one, ABG interpretation. So if COPD patients, ABGs are pH 7.28, PaCO2 60, BiGARB 25. So how should the nurse interpret this? A, respiratory acidosis uncompensated. B, respiratory alkalosis compensated. C, metabolic acidosis uncompensated. Or D, metabolic alkalosis compensated. So let's break this down, alrighty? You got to know the normal ranges. On NCLEX, they give you the normal ranges, but you still have to know what they mean. So when you're looking at pH, the pH in this problem is between 7.35 and 7.45. So the pH is 7.28. So that means it's low. So that means it's acidotic. So when you're looking at ABGs, now that you know that that the pH is acidotic, which of the other two, respiratory or metabolic, matches the pH? So let's look at PaCO2. It's 60. So that means you have a lot of carbon dioxide the patient's retaining. And what did I say? Carbon dioxide mixed with water is carbonic acid. So that's acid. So you have a low pH with acidic. You have a PaCO2, which is acidic. So you have respiratory acidosis. And the bicarb is 25. So with this question, the bicarb normal ranges are 22 to 26. And so 25 is within normal range. So it's uncompensated, because in compensated, that bicarb would be out of range to try to correct the acidity to make that pH normal. Alrighty. So just try to remember that. This is uncompensated respiratory acidosis, which is common in COPD patients due to the chronic CO2 retention. So low pH, high CO2 equals respiratory acidosis. And I'm going to cut it off here. I'm going to come back with another video with some more questions, and I'm just going to continue them. And I hope that this helps you. I hope this helps you with, I forgot to put the answer on there, I'm sorry. So I hope that this helps you with your studying, and I'm going to keep going, and I hope that you enjoyed. And, my goal is to really try to help you develop your critical thinking skills and develop what you need to be successful. And so with that, I wish you lots of luck. And come back and see some more from NurseEdScholar.